Breasts are made of fatty tissues. They contain small chambers called lobules, which is the site of the breast milk productions. The milk can travel through tiny channels called ducts to the nipple. Surrounding the breast tissue is a network of lymphatic capillaries that help in fighting disease. Breast cancer occurs when healthy breast cells become abnormal, grow out of control, and form tumors. The prolonged progression of the cancer may spread the tumor to the surrounding tissues. Both genders have the risk of getting breast cancer, with the proportion of 1 in 8 women and 1 in 1,000 men having that risk. Tumor that develop in the lobules is called as lobular carcinoma in situ or LCIS. When the tumor spread to the surrounding tissue, it will be called as invasive lobular carcinoma. The tumor also can develop at the milk ducts, and it is called as ductal carcinoma in situ or DCIS. When the cancer spread, it is called as invasive ductal carcinoma or IDC.
Good morning, everyone. Today we have Mr. Daniel, who is also a husband to a wife experiencing a breast cancer. Hi, Mr. Daniel. Do you know what is breast cancer?
Breast cancer is a malignant cells that grow uncontrollably in the breast tissue.
Okay. Do you know how can we support breast cancer patients?
I think we can offer emotional supports and give day-to-day tasks such as meals, childcare, and other than that, we can also encourage them to join support groups, and we can also raise awareness and funds for research and patient care.
I see. In your opinion, why do you think early detection is important?
Early detection of this breast cancer is important because it can improve the treatment outcomes, and also the survival rate is higher when when we do early detection of this breast cancer, and also we can prevent from the breast cancer cells from spreading.
I see. That is absolutely true.
So can I ask a question? What are some ways to spread awareness about the breast cancer?
Oh, regarding spreading awareness, there are some ways on how to do it. Some of the ways include organized awareness campaigns or events. Next is to share educational materials through social media, encourage people to wear pink ribbons to show support, as well as collaborate with healthcare organizations for free screenings, also mammogram drives. That is all for spreading awareness. Do you have any other question?
No, I think no.
Okay, thank you for your time, Mr. Daniel.
Thank you.
Hi, my name is Darwish. I'm a medical doctor, and today we will take a look on the case of a suspected patient with breast cancer. Let's go. So today we have a patient, female, 35 years old, with the complaining of having a lumps on her chest area. Let's go. Okay, so we are with our patient right now. Hi, miss. Can you explain about your complaint or what is happening to your body?
I noticed that there are changes in terms of the shape and size of my breast. Other than that, there is also lump at my breast area. And I also noticed that there are an identifiable discharge from my nipple. I'm not sure if it's blood or anything else what it is.
Oh, but have you experienced a persistent chest pain or, for example, like nipple area pain?
Yes, I do.
Oh, I think I know what is happening to your body.
Why, doctor?
Oh no, miss. I think you are suspected with breast cancer.
Oh no, what am I supposed to do now?
Okay, but before that, may I know, do you have a family history that have the same breast cancer issue?
Yes, my grandmother has it.
Oh, but how about smoking? Do you smoke or drinking alcohol?
No, I don't.
Okay. So my last question, have you ever went to hormone replacement therapy?
Yes, 5 years ago.
Oh, you do?
Yeah.
Okay, so based on this, these are the risk factors for breast cancer. So maybe to investigate more, we will send you for more lab diagnosis. Okay?
Yeah, sure. Thank you, doctor.
Alright.
female patient, 35 years old, suspected with breast cancer, have history. So for clinical examination, I will do the physical examination, taking her biopsy and also blood test, and I will ask her to do mammogram. So let's go. Okay, so you're the patient with suspected breast cancer, right?
Yeah.
Okay, based from our discussion, we need your blood sample for our diagnosis and also your biopsy. So biopsy, I will take some tissue sample from your breast so that I can observe the histological structure of your breast. And next, I will recommend you to go to the radiology and request for mammogram. So mammogram basically is an X-ray specifically for breast, and then we'll observe the tumor. So we can continue with our examination. Let's go.
Breast cancer can only happen when the tumor cells invade surrounding tissue, for example in IDC cases. Biopsy samples are taken from the patient to further examine the breast cancer. The diagram shows the histopathological image from biopsy sample of a breast cancer patient. Some characteristics that can be observed are the pleomorphic tumor cells arranged in tubular pattern, variable infiltration of tumor cells in the stroma, and also abnormal mitosis activities. Biopsy sample also can be used for cytological examination. The image shows the cytological finding of breast cancer that include aggregates with various size cells with three-dimensional clustering, variable size nucleoli, and also enlarged pleomorphic nuclei. One examination that can be done is mammograms, which is an X-ray examination for breast and widely used for detecting signs of breast cancer. A mammogram image will show a white lumps located at the breast area, confirming the presence of breast cancer. Another examination that can be done is the immunohistochemical test by evaluating the level of HER2 from the biopsy sample. HER2 is a protein that is responsible in controlling the cell growth. Cancer cells usually will have a high level of HER2.
Here is one of the ways on how to do physical examination for the breast. Firstly, raise your arms and then feel the area suspected with lumps and any other area as well.
Miss, okay, so we have received your result from the lab. So unfortunately, it is confirmed that you are suffering from a stage 2 cancer breast.
Huh? Are you sure? What am I supposed to do now? What are the treatment options for me?
Okay, so luckily it's only stage 2. So we will suggest you to perform a mastectomy, which we will remove the affected area of your breast, and we need you to perform a chemotherapy for several sessions in order to kill the tumor.
I see. Okay then, thank you, doctor.
Okay, let's go.
Wait, doctor.
Yes?
I have a question for you. I have a daughter, so what am I supposed to do so that she doesn't experience the same things I do?
Oh, okay. So what can you and your daughter do is first to start practice a healthy diet, eat good foods, healthy foods, and also next I can suggest you to exercise regularly so that your hormone can be stabilized. And lastly, you and your daughter can go regular breast screening so that we can detect early if there is any symptom that you are experiencing now.
Okay, thank you, doctor. I'm glad you explained that.
Okay, hope that your daughter doesn't have the same thing as you are. Let's go!